We're going to be looking at diagnosing a sacroiliac joint problem, and there are two things that you need to look for. Actually, there's three tests, but the first two are more signs. The first thing you're going to look for is what we call a broken windshield wiper sign. As the person is either standing or lying down, you're going to look and see if the toes are pointed in the same direction. Look at the feet. If one foot is hanging out more than the other, that is a positive sign, and the likelihood of a sacroiliac joint problem is in the 90+ percentile. So over 90% chance that you have a sacroiliac joint or SI joint problem. The other thing you look at is the heels of the shoes. If the heel contact wear patterns are different from one side to the other, that is also an indication that there is a problem with the hip and the sacroiliac joint. That means that the foot during walking or running is not being placed in the right spot, and that tells us that there is some sort of muscle imbalance or some issue going on in the pelvis. The last thing you want to do is you want to look at feeling the back of the SI joint, and we do this by looking for the dimple in the low back. There's two of them, one on either side. Right inward from the dimple is the sacral base, and you're going to be right on the back of the joint. So find the dimple, reach in a little bit, put some pressure in. You can test to see how much mobility is going on, but also you're looking for pain, reproduction, and if one side is different than the other.